Good afternoon, everybody. It's afternoon, I believe, for most of you, possibly evening for some. There are some who are joining us in their morning time. You are all very welcome to this ICN hosted webinar where we're going to be focusing on nursing in the WHO SEARO region. We ran during the pandemic a whole series of webinars for people to share their experiences, discuss challenges and solutions. Those were very successful, and as a result of that, we have now started to have regionally focused webinars. We held one just recently with all of our associations across Latin America, and we're delighted to be able to host this webinar for the SEARO region today. Colleagues, just to say that both the chat function and the Q&A function are open. Obviously use the chat function to say hello, talk to each other, but please just use the Q&A function for questions that you may have that come up during the course of the webinar. The ICN team will be monitoring the Q&A box for your questions, which we will be putting to our panelists later. Colleagues, without further ado, let me now turn to Dr. Pamela Cipriano, the ICN President, for her formal welcome. Madam President, the floor is yours.
Thank you, Howard, and I join Howard in welcoming all of you today. This is a really great opportunity for us to hear from you. It is only we're only going to be effective if we understand what's happening out in the field. What are the issues that you're dealing with? How are you able to manage and address the key priorities that we're all working on? Because we know even though we're very similar in the issues that we're addressing, they take on a slightly different effect depending on where we are, depending on what some of the emotional, financial challenges are, workforce challenges, and we'll be discussing some of the most recent developments that ICN has been working on, and again want to hear from you how these issues are affecting nurses in your nations and how you are able to come together with your colleagues to be able to put in place solutions, work with other groups and collaborate so that we can be effective, not only, again, with each NNA, but with the force and strength and influence of ICN. So I look forward to our conversations today. As Howard mentioned, we believe this is a really important way for us to be able to enhance our communication and understanding. So we're excited to be able to have this regional meeting, to hear from you, to dialogue with you, get your questions as well as, again, plan together for how we go forward on some of these really important issues. So thank you for being here today. Thank you for those who are going to share with us some of the interventions, and we look forward to an active dialogue.
Thank you, Madam President. Colleagues, you'll know that the ICN board is comprised of elected nurses from every region of the world, and our board member, we're delighted and honoured, our board member for the SEARO region is with us today, Dr. Nanthapan Chimla-Prasad, who is with us and is going to offer her welcome to you all as well. Nanthapan, over to you.
Thank you, ICN CEO, Mr. Howard Ketton. Dr. Pamela Cipriano, ICN President, colleagues from ICN, colleagues from NNA in the Southeast Asia region, ladies and gentlemen. I'm Nanthapan Chimla-Prasad, ICN board member representing Southeast Asia region. It's my honor and great pleasure to welcome all of you to the ICN webinar today. The webinar is one of the channels to meet with colleagues in the region to share our point of view regarding development of nursing profession, as mentioned by the President, As we all experience the recent COVID-19 pandemic, the working system and nursing system have been changed and adapt dramatically. Today, I believe that we will all take this opportunity to share our experiences and build network for the future collaboration. Once again, welcome all of you. Thank you.
Nanthapan, thank you very much as well. Colleagues, we do also have board members from the neighboring region. We have Professor Megumi Tashimi and Lian Wawu from the ICN board. You're going to be hearing from them later. They're going to be joining our panel later on in this webinar. Colleagues, what we first want to do is to take a few minutes to update you on some of the key ICN work that we've been engaged in over the last few months. It's been an incredibly busy period with International Nurses Day, with the World Health Assembly, with the Triad meetings as well. And we're just going to run you through some of the key work and some of the key activities that ICN has been involved in. All of you, of course, know 12th of May, International Nurses Day, and the theme that the ICN board selected for this year on the front cover of the report that you can see the slide, Nurses a Voice to Lead. We have been using that line for the last few years, is strongly supported, we know, by our national nursing associations. But this year, with a focus on invest in nursing and respect rights to secure global health. Colleagues, you'll know that we have a fairly new global nursing and midwifery strategy, the strategic directions for nursing and midwifery, and you'll be aware that that focuses on 4 key areas: the need to invest in nursing education, nursing jobs, nursing leadership, and nursing practice and service delivery. And in our IND publication, we include a lot of practical examples as well as policies that can be implemented in order to deliver that investment in education, jobs, leadership, and in nursing practice. So our International Nurses Day publication very much supports and aligns with the global strategic directions for nursing and midwifery that we have. However, this year we also added 2 other critical issues: the safety of nurses and their colleagues, and the health and well-being of nurses. We did that for a number of reasons. You'll know that we have been monitoring very closely the impact of the pandemic on the nursing workforce, and we were very concerned about issues of safety and protection, high infection rates, sadly, far too many deaths of our colleagues that we have seen as well. In addition, we've seen the war in Ukraine, the invasion of Ukraine. We've seen the impact that has had on nursing and healthcare staff. And I have to say, in conflict zones and other conflict zones around the world, you know, very worryingly, an increase in attacks on healthcare staff and healthcare facilities. And just yesterday, colleagues, we released a report in conjunction with the International Red Cross, the World Medical Association, the International Hospital Federation, which showed, based on a survey of a range of healthcare professionals, an increase of nearly 60% in people's concerns about experiencing violence or being subject to attacks at work, not just in conflict zones, in places where there is not conflict going on, but where there is still this high risk to nurses' safety when they are at work. And it is for those reasons, colleagues, that we added the safety and protection of nurses and the health and well-being, not just their physical health, but their mental health as well, to the IND publication. We know it's been widely used and it's been widely picked up, and you can see the reach there of the report this year. Next slide, please, Cyril. The other thing that we did on International Nurses Day was to formally launch a number of the films that have been made as a result of the collaboration that ICN and the project that we have had with the BBC. The BBC came to ICN over just about a year ago and said that they wanted to showcase and highlight the reality of modern day nursing from right the way around the world. And we have worked with them to bring forward some films about nursing practice, nursing innovation, nursing models. The BBC called the project Caring with Courage, which we absolutely support. It seems incredibly apt. And from the link you can see on the slide, that will take you to the BBC website, where currently there are, I think, 13 films. They're short films, they're 5 or 6 minutes long. They're incredibly well done. They're done by the BBC, but they're very powerful in terms of showing the reality of what nurses are doing, often in settings that people might not immediately think of where nurses work. I commend the films to you, would encourage you to look at them, because I think that they can be very, very powerful in your lobbying, in your advocacy in country, to take these to politicians, to policymakers, and say, look, this isn't a pipe dream about what nurses can do. This is a reality of what nurses are delivering now. Here are ready-made nurse solutions to some of the challenges that we are facing. So that's some of our key work colleagues in relation to International Nurses Day, but International Nurses Day was then followed quite quickly by the biannual triad meetings, and I'm going to pass now back to the ICN president, who's going to talk you through some of the work that we did at the triad meetings. Madam President, the floor is yours.
Thanks, Howard. Many of you may have participated in a previous triad meeting. And so just to review, for those of you who've not had the opportunity, this meeting traditionally brings together the chief nurses of every country, the regulators, and the representatives of our National Nurses Association. This year, because it was virtual, we had the opportunity to add representatives from educators. So in some respects, it was a quad meeting. We had a number of panels that represented that. But as you heard Howard mention, one of the key areas of focus was the global strategic directions for nursing and midwifery. And we believe that it was very important that we focus our attention collectively on how do we accelerate the implementation of this work. So this meeting is co-sponsored with the International Confederation of Midwives, and it is spearheaded with the World Health Organization together with ICN. We brought together this time 165 countries, 650 delegates. So the virtual forum actually allowed us to be able to engage more individuals. One of the things that, again, was very clear, though, is that we were very intentional and purposeful in saying we have to really focus on the investments in our nursing workforce. As you can imagine, everyone has been consumed with the impact of COVID, and that was really, how the discussions began. Not only did COVID disrupt our workforce, you can imagine the impact of disrupting the delivery of health services everywhere. So we talked about that impact. We also talked about the fact that the strategic directions really does focus on 4 critical areas that require investment. And those are education, jobs, service delivery, and leadership. And you'll hear the word investment repeatedly, focusing on where have we underinvested in nursing? What's the risk? What's the risk for being able to deliver universal health coverage? Underinvestment from the standpoint of nurses and opportunities and education and advancement of the profession, as well as really calling for the ability for us to have investment to create better and safer work environments, to be able to have fair and equitable pay. So all of the issues that we know have been fundamental to our platform and our messaging around creating a robust workforce, making sure that we retain our workforce. Some of the other aspects of the discussion at the Triad meeting also deal with being able to have nurses practice to the full extent of their education. And depending on how nurses are regulated, whether it's education and training, whether it's education and licensure, but really being able to fully utilize nurses, midwives, and all of our support personnel. And this is actually something that in some countries is under attack, because we are competing at times with other professions, as well as governments that want to have a lower paid, less professional workforce. So this is an important aspect of being able to continue to send the message that we want everyone to practice to the full extent of their education. We also want to be able to influence and adapt new strategies and new models of care. And again, as you had heard Howard mention, part of the way we're doing that is to be able to use our media partners and help get the messaging out that nurses are providing exceptional services. They are being innovative and creative, and we need to advance those models and innovative approaches that strengthen our capacity as an overall global workforce. One of the other interesting findings that was presented early on in the meeting, and this remains a little bit controversial for us at ICN, is that initially there was a report that there has been some easing in the projected shortages of workforce personnel that occurred actually pre-pandemic. So we are very anxious to be able to continue the dialogue about updating the report on the state of the world's nursing. That will be a better data collection that'll give us a snapshot of what has happened during the pandemic, and as we hope we are coming out of the major thrust of the pandemic, because we know nurses in particular and midwives have left our workforce in many countries reporting about 20%. And so we really need to understand what has happened. The other aspects of the work that was discussed at the Triad, and we had a number of wonderful representatives from ICN, including Professor Megumi Tashima, and what we again heard was that we must address the workforce. We must address the safety and welfare of nurses. That was a consistent message, and as part of that, you're going to hear in just a moment from Dr. Hoishan Fodokala about some of the other work that then transpired, not only in our discussions at the Triad meeting, but went on to be affirmed at the World Health Association meeting, because all of these things are linked. As you know, your work and our collective work at ICN is very focused on workforce. And so we were very pleased to be able, again, to have this dialogue around making sure that we are protecting the workforce, that we are enhancing the ability for nurses to practice, to be able to get more education, to be able to provide more care, access by providing a full scope of practice, and that we continue to be very focused on making sure that we are addressing the shortages that we think are only getting worse, particularly in low and lower middle income countries. So we believe it was a very productive Triad meeting. We have a very good relationship with all of the parties that come together for Triad. We will continue our collaboration with WHO and with ICM as we look at the critical role that ICN plays as a formal partner in making sure that we advance this report. So those are the key points that I would like to make. And now we will hear more about the additional work, particularly focused on workforce and some of the major policy directions that were then codified at the World Health Assembly.
Thank you very much, Madam President. And we're now going to turn to Hoishan Fodokala, who is one of ICN's policy advisors working as part of our nursing team. Hoishan, over to you.
Thank you, Howard. Thank you, Pam. Hi, everyone. Good morning, good afternoon. Greetings from Geneva. My name is Hoishan Fodokala. I'm policy advisor in nursing and health policy team at ICN. Can we move to the next slide, please? And thank you for having me in this webinar. And in the next 5 minutes, I will briefly talk about ICN's activity in the 75th World Health Assembly. As you all remember, the 75th World Health Assembly took place from the 22nd of May to 28th of May. And due to the ongoing pandemic, the World Health Assembly was held in a hybrid format with a limited number of delegates attending in person. So we know that the WHO is the supreme decision-making body of the World Health Organization and is attended by delegation from all 194 member states as well as non-state actors in official relations with the World Health Organization. And the theme for the 75th World Health Assembly this year was Health for Peace and Peace for Health. And ICN, as one of the first non-state actor in official relations with WHO, we are invited to host a delegation to the World Health Assembly and attend committee meetings and side events and contribute to discussion through written and verbal statements, which are entered into the official record of the meeting. And this year, the ICN delegation took a hybrid format with most delegates participating virtually and a small group of ICN staff in person in Geneva. We were very pleased to welcome over 70 nurses from 40 countries around the world, which included representatives from ICN National Nursing Association members, ICN affiliate members, ICN Board of Directors, scholar and alumni of the Global Nursing Leadership Institute, and ICN staff and consultants. ICN also hosted a student delegation of 14 nursing students and early career nurses. So every year, ICN delivers official statements on key agenda items, providing the nursing profession a powerful opportunity to highlight development in nursing practice and demonstrate how nurses are shaping health and healthcare and social systems. The ability to deliver this statement makes the World Health Assembly a significant platform for the global health advocacy on behalf of all of us, 28 million nurses around the world. And here you can see on the PowerPoint slide is the list of intervention items. So this year, ICN delivered statement on human resources for health, WHO preparedness. Previous slide, please. WHO preparedness for emergency, infection prevention and control, public health and drug problems, global health for peace initiative, and prevention and control of NCDs. And you can find all the statements in written and video formats on ICN website, icn.ch. Next slide, please. And ICN WHO report is just out today and is available on our website. You can click onto the nursing policy tab and ICN and WHO. And the report was prepared by my colleagues, Eric and Burden, ICN consultant. And this annual ICN WHO report outlines the key nursing policy consideration as they relate to the current context of a variety of global health issues that have been prioritized by ICN for the nursing profession. And I think it's very, very helpful because it will give you an overview of the main global health issue addressed on the WHO agenda that are of particular importance to nursing and positions the nursing professions and its contribution within the global agenda. And the report also provides guidance to where and how efforts to advance health and healthcare should be focused, and the most strategic ways to do so at all levels, and using multi-stakeholder approach. And it can be used as a strategic document to support nursing policy and development. So you're very, very welcome to download the report on our website and widely disseminated in your networks. And next slide, please. And I also would like to share a quote that WHO Director General Dr. Tedros mentioned in the WHO It really shows ICN's strong presence and the crucial role of nurses in the World Health Assembly. And he mentioned nurses have shown over and over that they are the cornerstone of health around the world. And he salutes all of them for their tireless dedication and resolve. And thank you, ICN, for your strong collaboration with WHO to advance nursing. And the next slide. Next slide, please. Yes. At the end, I would like to let all of you know that the next ICN Congress will take place in Montreal, Canada, from the 1st to the 5th of July next year. And the call for abstract document is already out. So you or your colleagues can submit your abstract from the 1st of September to the 31st of October this year. And for more information, please check our Congress website or our ICN website. Thank you very much, and I will pass the floor back to Howard.
Hoi Shan, thank you very much, colleagues. You can see what a busy period it's been, and just to reinforce that WHO report is available as of today, and you can, in that, you will see exactly what we were saying, the points that we were making, the interventions that we delivered, and please do use it for lobbying, for activity, for policy work that you may be doing in your country as well. Colleagues, when we have been working with the World Health Assembly, but also with the regional webinars, a key and critical partner for us has been, of course, the World Health Organization. And I'm delighted that for this webinar, the nursing advisor for the SEARO region, Tani Miso, has been able to join us, and she is also going to bring us an update of some of the key work and priorities from the SEARO region. I thank you very much for finding the time to be with us. We're looking forward to hearing from you, and the floor is yours.
Thank you very much, Howard, for the introduction, and thank you very much for the invitation. I'm really happy to be here. Really warm welcome to everybody. Good morning, good afternoon, good evening. Again, thank you very much to ICN CEO, Mr. Howard Catton, the President, Dr. Pamela Cipriano, the board members, especially SEARO's board member, Dr. Nantapan, and the presidents and representatives of the respective Nurses Association of SEARO, and distinguished guests. So my name is Tani Miso. I am the Technical Officer for Nursing and Midwifery at the Southeast Asia Regional Office for WHO. Can you please project my slides, please? I think the transition, with the interventions earlier on, fits in really well with what I am going to be speaking about. Next slide, please. So I just wanted to bring everybody's attention to the work of the Global Strategic Directions for Nursing and Midwifery 2021 to 2025. This is what all the countries are working towards, and WHO from a three-level we are supporting, so from the HQ, regional level, and the country level, whenever we do receive requests from the countries, we are supporting to advance in these 4 priority strategic directions and the 12 policy priorities for the strategic directions. And I won't talk too much because I think there was a lot that was said before. Next slide, please. One thing I wanted to highlight also was some of the regional priorities. So for SEARO, we have the Decade of Strengthening HRH in the region for 2015 to 2024. Just wanted to highlight that we are making progress across the SEARO Decade priorities, including transformative education, rural retention, governance and service delivery, data and information, and international migration. I think there's definitely an increased focus on primary healthcare workforce teams. And we know that while numbers are improving, there are important challenges that remain with respect to distribution, composition, competence, and performance. And next slide, please. I just wanted to highlight some of the indicators that we do collect for the CR decade, and we need your support from the presidents of the National Nurses Association. These data are so critical. These were the indicators that were included in the State of the World's Nursing Report, and whenever we have updates, we do collect it from the National Health Workforce Account platform. So please do get in touch with your NHWA focal points, and to make sure you could help out inputting the correct data so that we receive them. Next slide, please. So I know that there was a lot of discussion with the World Health Assembly at a global level, but from the regional level, we actually have the regional committee. The 75th Regional Committee for Southeast Asia is coming up between 5th and 9th of September, and it's going to be held in Paro, Bhutan. The RC is basically the governing body for the region, and it's comprised of the representatives from the region's 11 member states, as well as the associate members. And we meet every year to formulate policies, provide oversight for regional programs, hear progress reports, and consider, revise, endorse new initiatives. And ICN is one of the invited members. So I do encourage that the presidents of the NNAs get involved in the upcoming RC as well. Next slide, please. Some of the key agenda items that are coming up, I thought that would be impact nursing, is the topic on NCDs, health emergency preparedness and response, accelerating the elimination of cervical cancer. That should be another point, I apologize. Ending preventable maternal newborn child mortality. And there is one focus specifically on HRH, which is the strengthening health workforce education and training. And last slide, please. And there are 2 publications coming up for the RC that is relevant to nursing. So there is a report on the nursing profession in Southeast Asia region, which it's going to be on the 6 countries that we were able to work with. So Bhutan, Indonesia, Maldives, Sri Lanka, Thailand, Timor-Leste will be included in the report. And then we also have a regional competency assessment tool for nursing educators. So this will all be coming out in September during the RC. So thank you again for letting me provide some updates from the WHO CRO region. And back to you, Howard.
I thank you so much. Super helpful. I wasn't aware of the nursing report that's coming up for the regional committee. So really helpful heads up on that. We absolutely need to look out for that and to engage with that. And colleagues, for all of the regional committees, because of ICN's status with WHO, we receive invitations, and then we work with the associations in the regions to try and identify someone from one of the associations in or close to where the meeting is being hosted to attend the regional committee. So we need to do that for, in the process of doing that for CERO for all of the other regions as well. And I think this year, a number of the regional committees, there's the opportunity for us to make interventions virtually as well. And we are certainly looking at doing that as well. Colleagues, just to remind you, Q&A function is there. Anything that you've heard that you've got questions on, please do put them into the Q&A box, and we'll have a look at those and hopefully pick some of those up later on. But now it gives me very great pleasure to move on to hear the interventions from some of our national nursing associations and the presidents for the national nursing associations. I think there are about 11 countries within the CERO region, and I know that we have members in at least 8 of those, and we're going to hear from a number of them now. Firstly, somebody who needs really no introduction, the president of the Indian Nursing Council, Dr. Dilip Kumar. Dilip, very, very good to see you again. The floor is yours, sir.
Good afternoon, good morning, good evening. Dr. Pramila, the ICN President, Howard, CEO of ICN, board members, and distinguished colleagues, Tanimuji from the Regional Technical Officer of SEARO, and ladies and gentlemen. Greetings from the Indian Nursing Council to all of you. First of all, I would like to congratulate the World Health Organization, especially Dr. Tedros and the Dr. Nigel Crisp and the ICN for taking the nursing in a global agenda, which has for the first time to come out with the global reports. And these global reports have focused on, I think, on the 4 themes, which in my opinion, while working as a chief nursing officer of in India and also the regulator, the 4 themes are music to the ears to me. The issues and challenges which have been focused in this 4, it has captured all the nursing fraternity in India which is facing. So it's an opportunity for us how best we can make use of this, and we require a lot of support from the WHO and ICN, and at least to the 75th World Health Assembly. Historical, after 10 years, the agenda has came into the World Health Assembly, and the visibility of the nurses in the eyes of the public has increased during the COVID-19. So therefore, it becomes all the more a priority for the policymakers to push the agenda of nursing, at least at the national level in India, and to take forward this message. What we have constituted, we have Indian Nursing Council, JAPAGO, Trained Nurses Association of India, and the All India Government Nurses Federation. These 4 of us, we came together and we have formed a nursing midwifery for a change to sensitize the strategic direction of the nursing and midwifery 21-25, the resolutions of the World Health Assembly, to the policymakers, politicians, and for the nursing professionals. We had a series of webinars reaching out to the many people, and our aim is to see that how much we can focus to get these SDNM 21-25 implemented. But lot to be done, but definitely the focus has been flagged at the national level by the government of India, and we are seeing some visibility of some movement which is taking place in the implementation of this SDNM. At least we were able to take this agenda to the politicians, and politicians have taken up this agenda to the Ministry of Health, Government of India. And they have, after writing this letter, the Government of India has formed a committee to study this SDNM report. And because India is a big country, where we officially we say that about 2.3 million nurses who are there in India. So India is having about 30 states and union territories. So a big agenda to carry forward. So already the Government of India has written to all the states, why can't we have the nursing organization set up wherever the nursing positions, leadership positions are not there, to be created and to be appointed, and whichever the states which are not there, they have to be created. I think that's one big message has gone from the Government of India after the intervention of this nursing and midwifery for a change campaign, which was launched by the Indian Nursing Council and JAPAGO. And another big policy reforms which are coming up, the Bill National Nursing and Midwifery Commission, which is the amending the existing Indian Nursing Council Act, because the Indian Nursing Council Act 1947 has not been amended. So now the new bill has been already finalized by the Government of India. Shortly, it is going to be introduced in the Parliament for the amending the Indian Nursing Council Act. So this amendment is going to make a sea change of the nursing education reforms, which has been reflected, and this will have a lot of impact for the improvement and advancement of the nursing profession and improving the standard of nursing education, and especially the scope of practice, which is not there in the existing Indian Nursing Council Act, has been reflected in the new bill. And there are many reforms have been incorporated. And again, one of the with respect to the number of nurses are there in India, I think ours is Tanimiji was mentioning about the National Health Workforce Accounts, and in response to that National Health Workforce Accounts, before this message came from the World Health Organization, Indian Nursing Council has already had a live register, nursing registration tracking system. This nursing registration tracking system is going to have a unique number. Literally, we are capturing the photograph lively, going to the institution and having the email and the and also the telephone numbers, and also getting the unique identity number what we have in India. So which is linked to this. So we have captured 1.3 million nurses data has been captured. So we are in the process of finalizing this data, and once we have a data, it is going to facilitate for the any particular it will facilitate for a effective nursing and midwifery planning at the national level and also at the state level. Even at the district level, the collector will be able to type the district name. They will be able to find how many nurses and midwives are working in that district with their qualifications, with their designations, all the data they will be able to get. So it will help for the effective nursing and midwifery manpower planning at the national level. And we are due to the COVID, this was delayed, and we'll be able to complete this task. And we are
Dilip,
also
if
working.
You can just start to draw to a close, that would be great. Thank you.
Yes, I will take a minute. So we are also in terms of the advancement of the nursing profession, we are in the process of already nurse practitioner critical care syllabus, and it has been implemented. And we are also in the process of developing the various other specialty nurse practitioner programs. And we are also made a policy reforms in terms of the two types of entry into nursing, that is diploma and degree, single entry into the nursing, that is to convert all the diploma program to degree program. This proposal is lying with the Ministry of Health. And once the Ministry of Health takes the decision, I think we are going to have only single entry into nursing. At least now the Ministry of Health has permitted us, any institution voluntarily they want to convert the diploma program to degree program. That policy decision has been approved. So now many of the institutions are coming forward to upgrade the schools of nursing into the BSc nursing. To improve the quality of the nursing education, we have developed a state-of-the-art simulation center in India. It is one of the many of the international experts have visited this our state-of-the-art simulation center, in which we are training the master trainers. Our target is to train about 1,000 faculty in the simulation center, so that gradually we would like to have in all the states, and also the skill labs have been made mandatory in all these schools and colleges of nursing to improve the competency-based training program. Recently, we have also rolled out the BSc Nursing competency-based syllabus. So various activities which have been reported in conjunction with the SDNM. My only request and suggestion is that I think to take forward this SDNM report, we need the support of the ICN and also the WHO and the regional directors. The WHO headquarters and ICN should talk to the RDs, and RDs has to make it a point to talk to the country health ministers to make as to flag the importance of this SDNM. Then only it will percolate to the policymaker to implement. I think this has to be taken in a high agenda by the SEARO level at the level of the RDs, because many times so many issues are there. Agenda is big one. So, but if you miss this agenda now, we'll be missing the bus in the improvement of this strengthening the nursing and midwifery in India. Thank you very much.
Thank you, Dilip. Thank you very much. A huge array of activity and work going on and coming up. So extremely helpful, Dilip, to have that update from you. We're now going to go to the president of the Sri Lankan Nurses Association, Professor Sudath Wanatulari. Dr. Sudath, I know that you've had some connection. I see you, sir. I see you there. Sudath, over to you. The floor is yours. You're on mute, Sudath.
Sorry. Right. Good afternoon, everyone. Dr. Howard Cotton, the chair, and also the CEO, ICN, and also President, Dr. Pamela Cipriano, and board member, Mrs. Dr. Nandapan, and ladies and gentlemen, it's my great pleasure to address this international audience on behalf of Sri Lankan Nurses Association. Sri Lankan Nurses Association is the one of the oldest organization in Sri Lanka, represent ICN as well as Commonwealth Nurses Federation. I'm not going to talk regarding what we have done so far, but there are a lot of issues in Sri Lanka at the moment. We have more than 38 nurses registered and working in the Ministry of Health and all hospitals. However, there are only 6,000 nurses in active membership in National Nurses Association due to various reasons. Trade unions are dominant, and they are the people with power and politics and everything. Therefore, all nurses get attracted to this trade union, and very difficult to get into the professional organization because they can do many things and get the support from these people. As a national organization, what we do at the moment is with our membership, we are organizing different educational workshops, seminars, and also with the help of ICN. Sometimes before we conducted some wonderful training programs, disaster training. In the same manner, we are consistently knowledge development and skill development workshops are conducted. During the past decades, Sri Lankan nurses had to face various global and local challenges due to various reasons. As you all know, during the past years, we had very bad times, especially not only because of the corona pandemic. We had some other problems like natural disasters, Easter attack, terrorist attacks, and so many other things. Directly and indirectly, our nurses had to face various problems. During those disaster situation, all the time, our nurses played a significant role, and also their education and other professional development has not been exactly identified as priorities in Sri Lankan health authorities and the policymakers. Therefore, there's a big issue when you come to the professional development of nurses. I have highlighted this concern in different forums. As a professional organization, what we can do, we can give the messages, and also we can raise our voices. But if they are not going to hear those things, we are very helpless. We are experiencing helpless situation. However, during the corona pandemic, our nurses had to face various challenges again, because there were a lot of problems like other countries, you know, equipment issues, PPE issues, transport, and other working schedule problems. But fortunately, none of our Sri Lankan nurses have not left the job because of these challenges they have faced. Not only that, while facing those number of challenges, they continue to work, and also they gave great help during the difficult situation in the country, and also great support and help for this national health service. Around 10 nurses died due to, they had to sacrifice their lives because of the corona pandemic during the past months. And also, we are experiencing a major political crisis in Sri Lanka at the moment. I think you must have seen in news, Sri Lanka in a very crisis situation at the moment, that not only the political crisis, the economic crisis, and also other energy, especially fuel and electricity energy, there's a great problem. Not only that, in hospital, there are major issues related to drugs and also equipment and other materials problems. And also, when you come to this chaotic situation, India and China, they have supported Sri Lanka in various ways to facilitate healthcare system and other areas. But still, we are experiencing serious problem in the country as well as in the healthcare system. This political instability, and also we have currently experienced serious financial crisis. Because of that, large number of nurses, they have not left the profession during the pandemic, but now we experienced a large number of nurses leaving the job. leaving the job and going to any other country, because during the past few months, we have been experiencing a lot of nurses leave the country for other countries. Migration is increased. As all these problems we are experiencing at the moment, but however, during the past decade, we have been able to maintain very good relationship with ICN, and also we have been working with different forums and committees, standing committees, and we have been able to contribute to various aspects of the country. Currently, I am personally participating in this Montreal conference as a steering committee member, but I have a lot of things to say regarding the Sri Lankan situation and nurses' problems. I think we need really important policy changes and also the reforms for nursing education as well as development of nursing profession. I think with the permitted time, I have only to say all these things. Thank you very much for giving opportunity again. Over to you, Dr. Howard.
Sudath, thank you so much. I think we have all seen on our TVs the particular challenges that you and your country and the people of Sri Lanka are currently facing. You're very much in our thoughts. Sudath, just to let everybody know as well, in terms of some of the workforce issues that have already been mentioned and highlighted, we have in the last few days been able to confirm the dates of the Workforce Forum meeting for the Asia region. ICN has been holding these on a regular basis, but obviously they were interrupted because of the pandemic. And very, very kindly, the Thai Nursing Association have offered to host that meeting in Bangkok, 1st, 2nd of March next year. We literally only just confirmed it in the last few days, so we'll let everybody know formally, but seeing as it's come up, then that feels like it's a really important event for people to attend. We very much hope that you'll be able to join us if that's possible for those meetings, and we'll follow up on that as well. That's also then a perfect segue to Dr. Siron Sindhu, from the president of the Nursing Association of Thailand. Let me again express our gratitude for you for the offer to host that meeting, and let me now pass the floor to you to update from your country. Dr. Siron, over to you.
Thank you, Howard. Nice to see you again, even it's on the virtual meeting. We have met in Geneva a few months ago, and we have been a very good discussion about how we are going to progress nurses in Southeast Asia and in Asia especially. And we throw our full-hearted to host the event that we can join nurses in Southeast Asia, or even if other countries would like to join, we welcome you to Thailand. Or we are thinking of being, have the kind of a hybrid meeting if that's necessary to some countries. We are ready to use both if some country is not, available for traveling. So let me share about the situation, or you want me to, the things about the meeting. I think Dr. Nantapan have been prepared very well, and if you have any question, you can ask Dr. Nantapan. She has worked very hard for the meeting and be prepared already, and try to have the name list of the countries who are coming to Thailand, so that we can manage the event ready enough for all of our honorable people to come to Thailand. I think then I may have to share some progression of the nursing policy in Thailand. I think that we have, I would like to talk in 2 parts. The part 1 is in primary healthcare. Primary healthcare is kind of moving from Ministry of Public Health to the Ministry of Interior. So the way of managing primary healthcare will change. And we thought that it may be an opportunity for nurses to have a kind of higher rank, because in the Ministry of Interior, they still have some room, some area for ranking position of healthcare workers. So we are hoping if we prepare nurse leader well enough, they will have the better position in the healthcare, in the primary healthcare arena. So we may have about 2 or 3, 20 or 30,000 of nurses moving to the healthcare, primary healthcare arena, and have the position and control the primary healthcare in the setting, things like that. So at the moment, the nursing organization try very hard to put the concept of leadership and to try them to be able to manage healthcare in primary healthcare arena. So we are working on that. For the thing is, we are kind of recognize that we need expertise. Even our expertise is not that advanced nursing practice enough, but expertise in short course training, like 3 to 6 months training. That training, we can propose that if they have that training, they have extra fee, extra pay for the training. So this is kind of one development that is of nursing, to have them have more spirit in working, because if they have training, the training most likely that they have investment from the government to train 4 to 6 month training. The government pay for all of them, and they accept that they require kind of in the primary healthcare, they want nurse practitioner, but we cannot invest for 2 years program. So we invest for 4 to 6 month program for nurses to be able to work in primary healthcare as nurse practitioner, that they kind of doing work like primary medical care, things like that. So this is going to be extra pay for them. So kind of this is lacing up some spirit in primary healthcare arena. We moved a lot of patients to the home and community setting. So in this case, that nursing organization try to prepare our nurses to be able to have all those competency to taking care as people demands. Yeah, so the rank promotion is there, but it's not that easy. We try to push very hard to make them show their expertise, to have, they have rank, but you know, it's very difficult for nurses to go to that kind of rank. The thing is, I think we need to train nurses to be able to show the evidence that they have work, they have promote their work to at the quality level for the people. So that is the part of primary healthcare arena. So I think we have somewhat power in primary healthcare, because nursing is there. Nursing do the job for primary medical care for chronic illness, including end of life or palliative care at home or in the community. So we moving forward in that area. So, and the policy at the government level want the primary healthcare arena to be stronger well, they said to be stronger, but you know, the money is not putting in the primary healthcare enough. So in the hospital setting, we still, they accept at the top level, they accept that we have shortage of nurses and request all the nursing school to try to less the number of new nurses in the university, in nursing college, to have enough. They kind of mentioned that we are shortage about 30,000 nurses per year. So this is kind of the government invest in nursing education. So the people who come to nursing school have somewhat part of the money from the government for taking the course in the school, of the government school. I would say that the public school, not in the private school. In private school, nurses still have to pay for themselves to go through. So, but more than 70% are public schools. So nurses are eased off by the funding from the government to prepare nursing education. However, nursing education, the government pays just for baccalaureate degree, not for master and doctoral degree. Doctoral degree somewhat pay from the educational institute to have some funding to pay for nursing at the doctoral degree, for them to be prepared for to be the educator. Expert 4 to 6 months, the government also invests in nursing for them to have, you know, not very long, but somewhat they have improved their competency, you know, not drastic, but improve competency enough to help, you know, in some specific area, cardiovascular, cancer, things like that. So we have those specific area, and the Ministry of Public Health have the service plan, and all those service plan have nurses that they have to invest for nurses to be 4 to 6 months expertise in the service plan of specialty area, like emergency nursing, critical care nursing. They have service plan from community hospital to the tertiary hospital and super tertiary hospital. So they put the position of nurse expertise in all the service plan. And I would say we are not satisfied with the investment. But however, they have somewhat investment in nursing that they request, but that general nursing at the baccalaureate area is not enough to improve the quality of specialty areas. So they, you know, within these past 5-10 years, there are more investment in expertise area, but short course, you know, half a year or less than half a year.
Dr. Siron, if I could just ask you to draw to a close, that would be great, please.
What? I don't hear you.
If you can, you just draw to a close now, please.
Okay, all right.
Thank you.
So that is the thing that, and now the nursing organization try to prove that nursing is not the expense, nursing is the revenue. So we have things to prove that we are kind of, you know, going through that we are not the expense of the organization, but we are the revenue of the organization to make them invest more if we are the revenue, because most likely in the past, we are expense of the organization. So we are working on proving and having nursing as revenue of the organization, not the expense. Thank you.
Dr. Siron, hugely helpful, and thank you particularly for that focus on primary healthcare. And you'll find we've intervened quite a lot on that issue, and it's also covered in the WHO report. There's more we need to do, but again, a really important priority for us at ICN. I'm now delighted to be able to go to the president of the Myanmar Nurse and Midwives Association, Professor Do Yin Mai. It is very good to have you with us. Professor Mai, the floor is now yours.
Thank you, Hartmut. Good afternoon, good evening. May the President of ICN, Mr. Howard Cotton, was CEO of ICN board members, and WHO SEARO representative, and ladies and gentlemen. First of all, I would like to thank Mr. Howard Cotton, CEO of ICN, for giving. Today, I would like to discuss the current nursing situation in Myanmar. I hope you already know about our country's situation. In 1921, Myanmar has the critical situation because our political crisis we have been a political crisis in the country. After the changes of political crisis, 2/3 of nurses and midwives are away from their workplace. Now they may have financial and social problems, but we cannot support them because they are very difficult to contact. Some of the nurses and midwives may be stayed away from their native places. So now in Myanmar, more shortage of nurses and midwife workforce at the hospitals and community. Before this meeting, I asked some senior nurses and junior nurses what they want to tell the ICN. So they said our country's situation is not peace and unstable. So after the peace and unstable of the country, they would like to ask the ICN for the training, not for all the old nurses, for the young nurses, for the leadership training. So thank you very much for your kind attention.
Professor Mai, thank you very much for joining. Again, we are very aware of the real challenges that you and your colleagues currently face, and we have been able to share some of those experiences and voices over recent weeks and months, including at our congresses as well. And we hear you in relation to the need for leadership training and development. Colleagues, our last intervention from one of our associations. I'm delighted that Dr. Anggu Walu, who is the head of international affairs for the Indonesian National Nursing Association, is able to join us and to speak on behalf of President Fadilah from the Indonesian Association. Dr. Agun, the floor is yours.
Thank you, Howard. Ladies and gentlemen, Dr. Siriran, and all of you. I just want to say small things because the story that have been shared by Dr. Sirion is similar to Indonesia's situation. We also have, instead of those like nurses as not the revenue, but the division who spend money, we are struggling to convince to the government and especially to the policymaker within the hospital and health facilities. Other problem that we are still facing is we are now have a lack nursing workforce because of the pandemic situation, where around more than 700 nurses have died because of the pandemic. And we are still have a situation where in some provinces we had low salaries due to Indonesian situation of the inflation because of this world economic crisis. And in general, we don't have a clear career ladder. So that makes the salaries that makes caused by the various qualities of nursing training in the country. So despite of that situation, we were trying to see what is the Indonesian National Nursing Association role. So we are now seeing that the Medical National Association in Indonesia, they are facing the situation where they have two medical association because of the political issues. And now we in nursing, we tried to not having that experience by try to make them united in one association. We are trying to assist the needs in every provinces and try to empower them and advocating, especially if dealing with the health policies or health policies makers in the local government. So we're now working on advocating national and local government policymaker in recruiting new nurses to replace those who have been passed away because of the pandemic. And also we do advocating to the parliament and the government in improving career ladder of nurses and wage system in national and local policies. And we try to collaborate with universities and nursing specialists association in ensuring the competencies is met with the curriculum made by the universities. So that is the general situation of Indonesia, and we are still working on this effort. And we are thank you for support from ICN, from WHO SEARO for endless assistance to Indonesian National Nurses Association. Thank you.
Dr. Agung, thank you so much for your contribution. Colleagues, we will write a report of this meeting and share that with you all. So we are capturing everything that colleagues have shared with us. I want to move now to a discussion with our panelists. Time, as always, is against us, but I want to ask each of our panelists, and I'm going to Nanthapan, just to give you a heads up, I'll come to you first in just a moment. But I want to ask each of them to reflect on what they've heard. I mean, I've been struck by the fact that I think all of the key pillars of ICN work, from workforce to regulation to education to professional practice to leadership, have all been touched upon in the interventions that we've heard. So to hear from the panelists, each of the panelists, about which issue has jumped out to them as being particularly critical, and to give us a thought, not just on that issue, but how ICN can work with our associations, with WHO, to support and advance taking those things forward. So, Nantapan, I hope it gave you 30 seconds to think about that. But as the board member for the region, let me first come to you for your reflections on what we've heard so far. Nantapan, to you.
Okay, thank you very much, for this very challenging question. Actually, from the panelists, I think some problem will be the common issue. For example, the capacity building of the nurse that after COVID-19 pandemic will be the very important issue that ICN also can support through the networking in the region or from the ICN itself. And also in terms of leadership, I think, because most of the issue that come up in the country, we need the leadership of nurse to overcome and to resolve the problem. So I think the leadership development for nurses in the region also is very important to encounter with this kind of problem. Okay, and I know that some issue is very specific. For example, for Myanmar, which is already involved or influenced by the political issue. In that case, ICN also can support them in terms of knowledge training or in terms of some kind of issue that they would like to consult specifically, for example, workforce and so on. Okay, and that is thing that I think ICN and also the board member also can support through the networking and collaboration. Yeah, that's all. Back to you, Robert.
Nantapan, thank you so much for that, and also just to reiterate our thanks for the work that you've done, particularly to help us to be able to agree to host the Workforce Forum next year as well. It's clear from this discussion how important that meeting will be, and I'm extremely grateful for your help in making that happen as well. Nantapan, you talked about leadership, which I think means that I would naturally go to the third Vice President of ICN, to Leanne from the Taiwan Nurses Association, who have done a huge amount of work to support leadership development. So Leanne, please do feel free to share on that issue, on leadership, but also anything else that you were struck by during the discussion.
Thank you, Howard. I would like to start by saying that ICN has two leadership training programs. One is a Global Nursing Leadership Institute, GNLI, and Leadership for Change, LFC, which are designed to ensure that nurses are equipped with knowledge, strategy, and strengths they need to lead and manage it in health services and in nursing, through change and into a healthier future for all population. Through my work with Taiwan Nurses Association, I have been closely involved with LFC program for many years. Since 2015, we have trained 3 cohort LFC, and this includes not only Taiwanese nurses, but also 15 nurse leaders from Myanmar, Indonesia, and Vietnam. And the Taiwan Nurses Association has just had the first workshop of the 4th LFC cohort. We are pleased to have 7 nurse leaders from Mexico, Mongolia, St. Lucia, and the Philippines join us. Now, I would like to share 2 successful experiences that have helped to improve nurses' pay. The first example is in Macau. where they managed to change the duration of nursing school's training to bachelor degree level in 2000, and successfully managed to increase nurses' pay so that it is now the same as other government employees. The second example was in 2012 in Taiwan. At the National Taiwan University Hospital, I was the nursing director, and we were facing a serious nursing shortage. I proposed increasing pay for nurses by $100 per month so that they could get the same pay as other medical personnel, such as occupational therapists, physical therapists, respiratory therapists, and speech therapists. As a result, the average pay for nurses in Taiwan was increased by 11%, and the nursing shortage problem was solved dramatically. Finally, I want to take this opportunity to congratulate Indian Nursing Council for your excellent work, changing all your nursing school course to bachelor degree level nationwide. Your nurse and their patients will benefit greatly from this decision for years to come. Back to you, Howard.
Leanne, thank you so much. Colleagues, just on the issue of pay, to let you all know that we're planning to bring forward some new work from ICN this autumn on the issue of pay around the world. So we'll definitely have that before the workforce meeting next year as well. But just to give you a heads up to watch out for that. I was struck by the fact that we heard a lot about primary health care, and I think that gives me an obvious next link to go to Japan, to go to our board member from Japan, to Megumi Tsushima. Megumi, firstly, let us express our condolences at the loss of your former Prime Minister Shinzo Abe. I know that we've written to JNA about that, but I think those of us who've been involved in global health know that he was a really strong advocate for primary health care, and his loss will be felt sorely in the global health arena as well, of course, in Japan. Of course, reflect on anything that you've heard, but perhaps you might want to say something about primary healthcare as well. Megumi, over to you.
Thank you very much for your kind word for our former Prime Minister Shinzo Abe. Thank you very much. COVID-19 pandemic impact on nurses shortage seriously. In June, I had an opportunity to participate in the UPRO region, the presentation of Global Nursing Leadership Program, and they addressed an aging society in Asia. Asian countries are about to enter into aging society, and how to restructure healthcare system is major challenge. In Japan, there is still mandatory retirement age, 60 to 65. However, the physical function of elderly are diverse. In Japan, we have started to create a system to rehire elder nurses who have a lot of experience and knowledge as a platinum nurse. Working even 1 or 2 days a week rather than working full-time can contribute to reducing staff shortage and by contributing to work. For senior nurses can also maintain their physical and mental health. Of course, patient safety is critical point. As far as I know, 93-year-old nurse who works as a nurse at the citizen facility, at the senior citizen facility, once or twice a week, is the oldest nurse in Japan. She is a former director of psychiatric hospital. Anyway, we need to train new nurses in an enriching environment. Sorry, enriching environment. In order to success, to train the younger generation of new graduates, older nurses must also be empowered in the workplace to cope with the nursing shortage in our aging society. In order to work with the younger generation of nurses, older nurses not only develop the physical strengths, but also learn the skills, interact with others while respecting younger generation's values. So together, SEARO and UPRO nurses can pass the baton with wisdom to next generation so that more people can lead healthier and happier lives. Thank you. Back to you, Howard.
Thank you, Megumi. Thank you so much for those thoughts and reflections. And you mentioned patient safety, and ICN has for the last few years always collaborated very, very closely with WHO on patient safety, and particularly around Patient Safety Day each year. This year's Patient Safety Day is focused on medication safety, and we've just this week been talking to WHO about how we will support that, because of course there's a huge role for nurses as prescribers or administrators of medications. I'm going to go to the president at the very end of the contributions, but just before I do that, let me go to I. Obviously, different perspective, in that you sit within WHO, but I was struck by a lot of what you said was then reflected in the issues reflected in the contributions that we heard from our associations and from other panelists, and we know that the collaboration between ICN and WHO, not just globally but regionally, is I think it's fundamental in terms of moving these issues moving these issues forward. Often they can seem overwhelming and there's so much to do, but if we come together with WHO in the regions, then I think that makes us a much more powerful force for changes as well. But I wondered if you please do reflect on what you've heard, what may have struck you, but also perhaps any thoughts on how we can move forward together on some of those issues. Over to you.
Thank you, Howard. And you know what, before I start, Professor Teshima, that bell really made me homesick because it reminded me of my home in Japan. Anyways, and I'm going to make this intervention very short because I understand we are running short of time. So first of all, yes, thank you, Howard, for bringing that up. I feel that a lot of topics that were discussed really are relevant to the strategic directions of nursing and midwifery 2021 to 2025, and really what we are trying to focus on. From the WHO perspective at the regional office, you know, strengthening health systems and health workforce in order to move towards universal health coverage is one of the regional flagship priority. And this is why the regional director has appointed this position as well. And there is more activity coming for developing nursing. And I really hope that we can work with ICN more and the NNAs. And I just really want to thank the the presenters from the National Nurses Association. We can see your strong leadership through these health emergencies, climate change disasters, political, economic crises. And I just really thank you for, leading the frontline nurses to where we are right now. I know it's a difficult time for everybody, but huge, thank you from my part. And it has been such a privilege to hear from all of you today. I really hope that we can continue this us, and that we can have individual discussions if needed, and speak about how WHO country office and the regional office and headquarters can support to advance nursing in your countries. Thank you so much. Over to you, Howard.
I thank you. We're delighted to have you in the role that you are within the SEARO region, and whatever we can do to to strengthen and to build the partnership. Absolutely, that's something that we want to do, and I'm very confident we are going to do. We are going to do that, of course. So, colleagues, we're drawing to a close. So I'm going to go to our president, both to reflect on what we've heard, what some of ICN's priorities are moving forward, and Madam President, please feel free to include your closing thoughts within that response and reflection as well. Madam President, the floor is yours.
So let me start by thanking everyone, all of our presenters. I thank you for being with us. I think you've lent a lot to this discussion. My impression is, and we've just heard this through many of the comments of our esteemed panel members, we are truly reflecting the strategic directions for nursing and midwifery through all of our work, whether it is the collective work at ICN, whether it is through our national nurses associations, or whether it's through our collaborations directly with WHO or other organizations that we know we are aligned with. I think it underscores that we are at a critical time, whether your country is experiencing political or an economic crisis. It doesn't matter, because we all are aligned around the fact that there is a nursing crisis. And that means there is a universal health coverage crisis. So as we think about our work together to be able to deliver on global health, it really means continuing to focus and utilize the resources and the strength that we've bring together. Howard mentioned, a number of activities that we're working on, additional work that will come forward. We have been very focused on workforce, the sustain and retain report. We've been focused on looking at things like gender equity, pay equity. We'll be doing more around labor. We've heard repeatedly from all of you, leadership is important. We've heard about the sharing and generosity of groups like TWNA and bringing other individuals into those courses. We know that we cannot let up on every single one of these pillars that have been part of ICN's strategic plan, and now again are amplified and are the focus of all of our work together through the strategic directions for nursing and midwifery. So whether your top priority is improving your education system, or providing leadership education and training, or creating better avenues and models to improve the safety of care, or whether it's the safer conditions and protection of well-being in your workforce, every one of these is absolutely critical. And we appreciate the enormous leadership and work that every one of you are doing within your countries, because again, collectively, we know this will improve our ability to impact global health. And so ICN is very, very excited to be able to continue to partner again with all of you, as well as some of our other global influential organizations that we know are another important voice as we speak to health ministers, as we provide directives, as we give you documents that speak to the value of nursing, that talk about the need for expansion of our nursing workforce. So we know we have a tremendous amount of work to keep doing, and we appreciate all that each of you contribute to that work, and look forward to continuing within our regions, as well as, again, as we come together. So this has been a great opportunity to hear from SEARO, for you to reinforce for one another, again, the opportunities, the resources, and the will to work together where there are very specific issues that can allow for sharing. So thank you for that, and I look forward to our continued work together.
Thank you, Madam President. Thank you to all of our panelists, to all of our contributors and presidents of our national nursing associations. Yes, the challenges, are huge and feel very clearly very significant, but you know, I have just been struck by the strength, the talent, the vision of all of you. You are leaders of associations, you as the leaders of nursing and of health within the SEARO region. And I think that's what gives us all real confidence and optimism about how we can convert some of the challenges that we're facing into really meaningful improvements for nurses, for nursing and for healthcare as well. Thank you all for your time. Look out for the report that we'll send through to this. And clearly there are a number of things that we're going to be in contact with and working on from the upcoming regional committee through to the meeting that we've got next year as well. So we will work to make sure that we, of course, keep the lines of communication and collaboration open as we go forward. I wish you all well for the rest of your days. Take care and see you all again very soon. Bye-bye.
Bye-bye. Bye-bye. Bye-bye. Bye-bye.